Okay, meanwhile, in some actual good news, the COVID vaccine is going out en masse today. Tons of doses going out today, which is excellent, excellent news, of course. And the BioNTech head, he worked on the vaccine. He says that we should be getting back to normal by the end of next summer because at that point, all the vaccines are out there and life is what life is.
We know that we have a solution, yeah, and we know that we can produce many doses of vaccines, and we know that there will be also other vaccines which have shown efficacy, and therefore, people, we should be confident that we will be able to control this disease and the pandemic latest end of next summer.
That is Dr. Ugur Sahin, who is one of the heads of BioNTech, which worked with Pfizer to develop the vaccine. 2.9 million doses of COVID-19 vaccine are beginning to arrive. A lot of those are going to the most populous places in the country. So first in line are 17 million healthcare workers and 3.7 million nursing home residents. And then you get essential workers, teachers, first responders, and then you get 89 million people with pre-existing conditions. Now, here's the thing. I think that probably we should actually be working on people with pre-existing conditions first. If you're an essential worker, but you're 25 years old and healthy, you really should not be in line before somebody who is 65 years old and has serious pre-existing conditions. So the tranching doesn't make a whole hell of a lot of sense. Nonetheless, this is the way that the distribution is going to go. And the number of doses varies fairly widely by state in the early going. California is about to get 330,000 doses. Colorado is going to get 47,000 doses. But smaller states are going to get far fewer. Delaware only gets about 9,000 doses. Florida gets 180,000 doses. So the vaccines have begun to roll out. That is a massive win for the Trump administration. The media, however, are suggesting that it is the Trump administration's fault that people are skeptical about the vaccine because there's a lot of questions about who wants to take the vaccine. And let me be clear, the vaccine, in terms of the studies, has been proved to be effective. Does that mean that children should be getting it? Probably not. At least not as at first blush. They should be like last in line. Number one, because they are at least risk of this thing. And number two, because they're the least likely to transmit this thing or have intergenerational contact with people who are elderly. As I say, we should be tranching this thing out. And, people should be able to assess their own level of risk when it comes to getting the thing versus not getting the thing or damage if you do get the thing as opposed to not getting the thing. If you're 17 years old and you're not only unlikely to die of this thing, it's less likely to kill you than the flu. You may be like, well, not sure I'm into it. That's understandable. With that said, the widespread vaccine skepticism that has now cropped up on the left is clearly a product of the media hating Trump. Now the media are going to turn around and try and blame Trump for the vaccine skepticism they themselves created. On MSNBC, here we go. They were blaming Trump for blue state vaccine skepticism.
Yeah, and Yasmin, unfortunately, this happened because of just the horrible precedent that got set by the president and members of the Trump administration to politicize a number of treatments and even some of the efforts leading to a vaccine to this point.
Okay, that is Dr. Kavita Patel, a former Obama official, obviously. So it's about politicization. Never mind the fact that everybody in the process says the process was never politicized. In fact, the United States lagged behind two other countries, the UK and Canada. We were the third country to actually approve the distribution of the vaccine. Here's the FDA chief, in fact, saying external pressure was not the issue in us deciding to greenlight this thing.
Jake, we have been very clear, and I'll say it again here, that nothing guided our decision, no external comments, no external pressure other than the science and data guided our decision making. If you look at the timetable here, immediately after the Vaccine Advisory Committee, our team spent that night, we decided to go forward, and by early morning, before 7 a.m., we issued a statement saying that we were moving forward, working with Pfizer to get the authorization out. And then we worked throughout the day to do that. Our timeline, how we approached this, was based upon our thorough review of the science and data. That's the promise we made the American people, the transparency around that, and that's what we did.
So we're just going to whitewash completely the fact that Andrew Cuomo and Kamala Harris and a bunch of Democrats were casting absolute doubt on the efficacy of the vaccine developed under the Trump administration. Instead, we're going to pretend that it was Trump putting pressure on the FDA. The media's malfeasance with regard to COVID is the reason that people have serious COVID trust issues with regard to solving this thing. Another reason is because there are so many people who seem to be in the media eager to shut this thing down. Just super eager to shut down the economy, really eager to talk about how bad things are going to be for years on end. So Bill Gates, who has given a lot of money to the development of vaccines like this one, Bill Gates went on national TV with Jake Tapper, where he explained that life would not return to normal through 2022. 2022. And that we should not open bars and restaurants for 4 to 6 months. That's easy for Bill Gates to say. He's one of the richest people on earth. How about the people who actually own those restaurants? 2022, are you kidding me? Here's how this is actually going to work. Once the vaccines go out, and once we've given the possibility of dosing to everybody, everybody's going back to work. And people are not going to wear masks. They're not going to do it forever. They're not that interested in doing this for a long time. They're just not, it's not going to happen. But the sort of blithe dismissal Bill Gates has for normality is pretty incredible. Of course, it's easy to do that when you are, jetting around on private jets and living on private islands. Here's Bill Gates.
Certainly by the summer, we'll be way closer to normal than we are now. But even through early 2022, unless we help other countries get rid of this disease and we get high vaccination rates in our country, the risk of reintroduction will be there. And of course, the global economy will be slowed down, which hurts America economically in a pretty dramatic way. So we'll have, starting in the summer, about 9 months where a few things like big public gatherings will still be restricted. But, we can see now that somewhere between 12 to 18 months, and we have a chance, if we manage it well, to get back to normal.
Nope. Wrong. Watch. Once everybody has the opportunity to get vaccinated, and then the people who want to do, we're going back to normal. Okay? And nobody's going to pay attention to what Bill Gates has to say about any of this. And this is true with regard to masking. It is true with regard to everyday activity. Nobody is going to stay away from their families. By the way, a huge percentage of the spread is not in public events. It is family gatherings. So if we are, it's not these big super spreader events that are the real danger, really. It is people who have COVID going back home to mom and dad. People are not going to put off life for another 2 years. Not happening. Not happening. I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.